how many times a day do we come on? 3 or
Oh,
4?
a lot.
Yeah, and we just do little snippets of things, and people get a text message or whatever that we're on live. And so, like, what are you doing here in St. Louis, Missouri, at the Arthritis Center today?
Well, you guys are well known, at least in my circle, as your clinic, your caregivers who really do care about your patients, who are doing your best to make sure they're getting the medications, the treatments that they need, fighting case by case by case with insurance companies day in and day out to make that happen. So I wanted to see how you do it.
Well, we are so honored.
And we're going to get Wendell on TikTok, aren't we,
Yes.
Wendell?
So Claudia's going to help get
one way or another
Wendell on TikTok, and if anyone can do it, she can. She has built this amazing group of followers because we have 17,100 followers, and a year ago.
And that's for you guys. I had 15,000 before Wendell got here was my goal, and because of you guys, we got to 17.1 thousand. So thank you so much.
Congratulations, and thanks for what you do.
Hey, thank you.
So one of the things that we have been doing is showing other patients and other advocates. We even have people at insurance companies that watch us. But what we're doing is educating people on how they can get access to care. Because what we have found out is that the physician's office, we're just independent contractors, and insurance companies don't have to respond to us, but they have to respond to a patient appeal. So that's why we're doing this appeals clinic with Horace and his team, and this is truly the new prior authorization. So tell us about what you did when you worked at Cigna.
What I did at Cigna, I was vice president of corporate communications. I handled financial communications. I worked with my peers in the industry to plan and carry out reform campaigns, or actually campaigns to make sure reforms didn't happen. Spent a lot of time in Washington. I eventually grew disgusted with what I was doing for a living. I was paid well to mislead people. And that means misleading the media, misleading policymakers, misleading employers and the public. And I became a whistleblower 15 years ago today, actually.
15 years ago today, have whistle, will blow. That's Wendell Potter, okay? And I love what you do, and I love that you speak the truth and you're wanting to do good in the world. I mean, I feel like we all have fewer days ahead of us than we do behind us. At least you and I do, maybe not that one, but I want to tell people every one of us is a patient, and every one of us has a problem with access to care, and every one of us has been delayed or denied by an insurance company.
Yeah. And we're kindred spirits. You see day in and day out the consequences of the business practices of big insurance companies like the ones that I work for. I worked for Cigna. I worked for Humana before that, 20 years altogether. So I know how they operate. I know that the main objective is to make money, not to make sure that people are getting the care that they need.
Yeah, and we're living it on the ground every day here in Bridgeton, and in the rheumatology space, we have an opportunity to make patients' lives good and have it that they can live with their diseases. We are not curing anything here. We are managing diseases, and they're lifelong diseases. So what we have created is essentially like concierge level care for working class people. And as you've seen in my clinic, it takes 24 people to support one MD, and that is because the insurance companies and the pharmacy benefit managers and all of their administrative burdens.
Yeah.
Can you imagine how many more people we could help if we had all these other people working on direct patient care?
Exactly. About a third of what we spend in this country on healthcare is eaten up by administrative costs because of the business practices of these big insurance companies. You have to have a team to do that. And you're exactly right. What would our healthcare system be like if you had that many people on staff who were only providing care, only helping people get better?
You think we can get there?
We can get there, but you guys are a model for what can be done, what is being done.
You've woken up a whole new generation of people. Like at your conference, me and Julie left, and I was like, I'm changing the world. I'm changing the world. All because of you.
Well, wow. Well, I don't know if I'm blushing, but I appreciate it very much, and can't thank you all enough for advocating for patients like you do, for being a model for what can be done and what other other caregivers, other doctors, other clinics, other facilities should be doing and will be doing because of what you're doing here.
Well, it's an exciting time to have to be able to expose the underbelly of insurance and the pharmacy benefit managers. And but for the work you've done and the groundwork you've laid for years, we can stand in this place and do what we do. And we literally, I mean, 2 years ago, I told her, I want to meet Wendell Potter.
I got to your assistant.
Yeah. And she found a conference
Here we are.
up in Wisconsin.
Yeah.
And we flew up there and we listened to your speech. And I looked at her as soon as she got off stage. I said, "Follow me, bring your camera." She goes, "But this conference you got." I said, "I see the suitcase in the back. He's going to blast out of here. And I'm getting a picture with it."
I have tears in my eyes. Yeah.
Wow.
Yeah.
Wow.
Just because what you're doing is like, people don't realize what you're doing. There's so many people that have lost hope because of our healthcare system, because they've gotten stuck with the huge bills. They've had to file bankruptcy. Their doctors haven't cared like we've cared for our patients. And you really brought that to people's attention. And now with all, like, you started the advocacy movement. Like, we wouldn't be here if you hadn't been the first to have the
whistle to blow.
Yeah.
Well, I'm humbled and but so grateful for what you're doing, because what you're doing is to help these people that are not getting the care that they need, that all too often go without the care and live in pain or go bankrupt because of a claim denial or some prior authorization that was denied.
So tell TikTok how they can follow you and your newsletter. His newsletter is amazing. Yeah,
follow me. The newsletter is Healthcare Uncovered, and you can find it at healthcareuncovered.substack.org or wendellpotter.substack.org. It's free. We write a lot about how insurance companies really operate, including the PBMs that they own. The pharmacy benefit managers, the three largest ones, are owned by the three of the biggest insurance companies. It's really quite a cartel.
100%. So his newsletter is free. There is an option to be a paid subscriber, but you don't have to do that. I actually just paid for it this morning at $5.41.
And I noticed
two subscriptions. But one of the names that came up with was Jane White, which is one of my students. Yes, I am just so delighted to bring this level of scrutiny to insurance companies and PBMs. I literally feel like they're teetering on the edge right now. And what we need is a big push to say, we, the people, will not stand for this anymore. I couldn't agree with you more. I'm sensing momentum. Things are going to change, and you were right at the epicenter of that change. So thanks for what you're doing. Yeah, for sure. I literally am still fangirling if a 59-year-old can fangirl. So this afternoon, Wendell and myself and Ash, who is an amazing photojournalist, and Alicia, we're going to go interview one of our patients. And I'm super excited. Claudia is doing the Lord's work, and but for a 20-something, we wouldn't have these followers, because you know what? I can barely answer my phone. You know that? I get that. That's why I need to have a tutorial.
I have my phone number written down.
Whatever you want, we're going to help you with.
I appreciate it.
Because this is important, and this is your life's work and my life's work.
And it's my dream to help you.
It really is.
Oh, I'm honored to be here and grateful to know you.
Yeah.
And appreciative.
Oh my gosh. Like, I might cry. Okay. TikTok, we'll be back. Thank you.
Keep your eye out for Wendell's TikTok.
Wendell Potter, Healthcare Uncovered.
Subscribe.
Healthcare Uncovered. Google him, Wendell Potter, W-E-N-D.
If you're ready to fall down a rabbit hole, Google Wendell Potter. I'll see you next week after you find everything.
We'll be back. Thank you, everybody.
Bye-bye, everybody.